Hey everyone, and welcome to today's Explainer. I am so thrilled you're here because we're looking at something that honestly sounds a little bit like science fiction, but I promise you, it's deeply grounded in science fact. I mean, have you ever wished your body just had a fast charging cable? Kind of like when your smartphone hits that dreaded 1% at 2 p.m.? Well, we're going to explore an innovative, totally non-invasive solution for chronic pain and faster recovery. It's called PEMF therapy. It is absolutely changing how we approach healing, and I literally cannot wait to share the mechanics of how it actually works. Let's get into it. Okay, so here's our game plan for today. First, we'll meet PEMF therapy. Then, we'll explore the cellular battery jumpstart, dive into the proven benefits and evidence, and compare PEMF to TENS machines. After that, we'll review safety and contraindications, and wrap up with what to expect and, of course, the costs. It's a packed agenda, so let's keep moving. Section 1. Meet PEMF therapy. Okay, let's dive right into what this futuristic-sounding treatment actually entails. I know that acronym might sound just a little intimidating at first glance, right? PEMF. Whenever we run into a cluster of technical letters like that, it's always best to ground ourselves with a really fundamental question. What exactly is it? And what on earth do those letters even stand for? So PEMF stands for Pulsed Electromagnetic Field Therapy. It is a completely non-invasive treatment. It uses specialized devices, PEF machines, that produce these very low-frequency electromagnetic pulses. Now, the real magic here is that these pulses pass right through your skin without any direct physical contact whatsoever, so it's entirely painless, and it requires absolutely zero downtime. And you know what's really interesting? These fields actually create magnetic energy that is incredibly similar to the magnetic energy found naturally right here on the Earth's surface. Now, if you're sitting there wondering if this is just some unproven, brand new wellness trend, it's not. This technology actually goes back decades. Get this, the FDA originally cleared PEMF for bone healing and pain conditions way back in the 1970s. And it goes even further than that. NASA actually used PEMF to help their astronauts recover in space. Today, it's evolved into a widely used treatment for chronic pain and rehabilitation. So right off the bat, we can see this therapy is grounded in completely legitimate, time-tested science. Section 2. The cellular battery jumpstart. So we've seen the macro-level history. Now let's zoom in and understand how these magnetic waves actually interact with your body on a micro level. This step-by-step biological chain reaction is just fascinating. When you're injured or even just really stressed, the healthy balanced electrical charge of your cells gets disrupted. That disruption is exactly what creates pain and slows down your healing. So, in step 1, PEM sends pulsed waves directly to those affected cells. In step 2, it corrects that disrupted charge. It creates this negative electron-rich environment that improves membrane function and boosts ATP, which, if you remember from biology class, is basically your cell's energy currency. Then, in step 3, clinical studies show this process actually induces the release of nitric oxide, which dilates your blood vessels. And finally, step 4, that dilation allows a massive increase in blood flow and oxygen to the exact areas that desperately need repair, which rapidly speeds up the whole healing process. To simplify all that complex biology, you can literally think of PEMF as jump-starting the battery of your own body's natural healing. It isn't actually doing the healing for you. Rather, it's giving your exhausted, depleted cellular batteries the exact electrical charge they need to do their job efficiently again. It's a true jump-start. Section 3. Proven benefits and evidence. Let's zoom back out from the microscopic cell to look at the actual, real-world clinical evidence for patients suffering from various conditions. When we look at the evidence, we see a really vast range of applications. For osteoarthritis, particularly in knee studies, PEMF has strong evidence showing it's actually superior to placebos in providing pain reduction and mobility gains that literally last for weeks. For bone fractures, it's straight up FDA approved because it dramatically accelerates the bone healing process by increasing osteoblast activity. And osteoblasts are basically the little builder cells that make new bone. We also see solid support for reducing chronic back pain, dropping inflammation by fighting off free radicals, and there's even some really promising emerging data for post-surgery pain. I really want to pause and highlight this point because it is absolutely vital. PEMF slashes pain and quickens recovery without opioids. In an era where post-surgery recovery and athletic pain management rely so heavily on heavy medications, having a non-addictive, drug-free alternative that targets the root cellular cause of pain rather than just masking it is a total game changer for patient wellness. Section 4. PEMF PEMF versus TENS machines. This brings us to a very common question regarding a device you might have already seen at your local physical therapist's office. So the crucial point here is the difference in depth and the actual objective of the therapy. A TENS machine uses surface-level electrical stimulation. It's strictly for blocking nerve pain signals to offer you some temporary relief, but it doesn't heal you. PEMF, on the other hand, penetrates deep into the body with these pulsed magnetic fields. It doesn't just block a pain signal, it promotes actual, deep cellular repair and targets the root causes of the pain, like deep tissue inflammation. To put it simply, it's the difference between temporarily putting a piece of tape over your car's check engine light and actually popping the hood to fix the engine. Section 5. Safety and Contraindications. Let's shift focus and address any lingering concerns you might have by looking at the safety profile of this technology. Our source material explicitly notes that PEMF, quote, does not undergo major adverse events in its use under supervision, unlike medications. Basically, side effects are incredibly rare and very, very mild. Because these fields are low intensity and non-ionizing, long-term data shows really excellent tolerability. In fact, if users feel anything at all during a session, it's usually just a slight tingling sensation. The rare, mild side effects might include some temporary fatigue, a bit of dizziness, or maybe some warmth at the treatment site. But because your body quickly acclimates to the sessions, any of that drowsiness wears off very, very rapidly. However, there are some very clear contraindications we need to cover. You should not use PEMF if you are pregnant, as the effects on a fetus are still unstudied. Crucially, if you have pacemakers, defibrillators, insulin pumps, or cochlear implants, you absolutely must skip this therapy. The magnetic fields can cause serious interference risks with those electronic devices. It's also contraindicated if you have active cancer, epilepsy, active bleeding disorders, or organ transplants. So as always, while it is generally very safe, anyone with specific medical conditions or implants definitely needs to consult a doctor or cardiologist first. Section 6. What to expect and costs. Let's transition to the practicalities here. If you're ready to try this out, what does a typical 10 to 30-minute session actually look like? And, well, what's it going to cost you? While it does range widely based on your location and the specific device a clinic is using, a single PEM session typically costs somewhere between $30 and $100. However, it's super common for clinics to offer package deals. If you buy a package of, say, 6 to 12 sessions, it often drops the total cost down to somewhere between $200 and $800 for the whole shebang. For a specific real-world example, our source highlights Core Chiro Rehab, located in Southfield, Michigan. They actually bundle PEMF therapy right in with their chiropractic care, and their pricing starts at just $50 a session. They customize protocols specifically for back issues, sports injuries, and arthritis. And what's fantastic is they note that patients absolutely love this non-drug approach. Many of them walk out feeling noticeably looser and experiencing significantly reduced pain after just one single customized session. Well, we've covered the fascinating history, the incredible cellular science, the strong clinical evidence, and the logistics of how it all works. Your cells are the absolute foundation of your health, and when they are fully charged, your body has an amazing built-in capacity to heal itself. So I'll leave you with this provocative thought to chew on. If your healing has hit a plateau, are you ready to jumpstart your body's cellular battery? Thank you so much for joining me on this explainer. Keep learning, and I will see you next time.